I primarily do total hips and total knees. I take call in the emergency room, so I'll see a certain amount of fracture work. And then I do shoulder arthroscopy pretty frequently and knee arthroscopy. I'm Christopher Lyons, orthopedic surgeon at Penn Medicine. If you're in the emergency room and you have an open fracture or you have a bad fracture, we're going to go to the OR and take care of that in a timely fashion because there's not really an alternative. If you show up in my office and you have first time in with knee pain, well, we're going to get some x-rays, we're going to try some conservative treatment, and oftentimes you can avoid or delay surgery with that. Sometimes, they call it sports medicine, but it's not only about sports, right? It's about, if you want to play soccer and I can get you back to playing soccer, that's my job. If you're 60 and you just want to be able to walk your dog and I can get that done, that's my job. It's performance. Get rid of the pain and maintain a performance. And I think that has other kind of more wide-ranging benefits to the patient, because if the patients, say, have a bad hip or bad knee and they can't move, then they become sedentary and they're not getting good cardiovascular exercise, they're hard to maintain their weight. If we can kind of fix like a problem, we can have a positive impact on those issues. I think that the main advancements for just specifically for total knee would be that we're able to do the surgery much more rapidly with smaller incisions. The materials that we use are more durable so that you don't, I think, have to worry so much about wear and tear on the device 10 or 15 years down the line. And a lot of it is just knowing how to rehabilitate the patients more aggressively. And I was doing total knees in 1990. So if 1990, we thought we were doing, really great if we could move the patient in, say, 3 or 5 days out of the hospital. And now if the patient wants, I do my total knees as just straight outpatient. It's a big improvement in understanding how to keep them comfortable and how to rehab. I think the best part of my job is taking care of patients when they need a specific surgical procedure and we get a nice outcome from it. That's the best part of my job.